Elise, thank you so much for coming in. My name is Olivia.
Nice to meet you.
Nice to meet you too. So today is just pretty informal. The employee that works at the front desk just got me Charlie's case history information, so I have that here. I'll be referring to that throughout. But I'm just basically here to answer some of your questions about stuttering.
Okay.
What do you got for me?
Okay. So sorry, this is a silly question, but like, what is stuttering? Like, I know Charlie stutters, but what is stuttering?
That's a great question, and that is something that's difficult to wrap your head around. So to break it down, we have fluent speech and we have disfluent speech, and under disfluent speech is stuttering. So basically, fluent speech is how you and I talk. So it's an effortless production of words with regards to thought and muscular exertion. So basically, it's just how your words are coming out nicely. You don't really have to think about how your muscles are moving or trying to alter things as you go, because you're pretty confident that they're going to come out okay. Disfluencies, so basically everybody's a little bit disfluent. So I'm sure you'll hear me trip up on my words or make revisions as we go, just like all normal speakers do. Nobody's 100% fluent. So there are normal disfluencies, which would be phrase repetitions, revisions, as well as interjections. So just, what you can think of you doing, saying things like, which I am famous for saying a lot of. And then there are abnormal disfluencies. So these are things that disrupt the flow of speech that are categorized as either stuttering or cluttering. We're going to talk about stuttering. Basically, this is a disruption of the forward flow of speech that can take many forms, and generally it is associated with repetitions, prolongations, and blocks. So looking at your case history here, I have that Charlie uses part word repetitions, so to say things like part,
Right.
to get a word out. Okay.
Yeah.
And within a month ago, he started struggling to get out words.
Yeah, so like, it was as though he was trying to say something, but nothing was happening. Like, no sound came out.
Okay, to me that sounds like it might be a block, which is exactly as you said. He's trying to say a word, but nothing's coming out. He can't even make a sound. So basically, I'll use a block here on the word block. So he might say block.
Right. Yeah,
Okay.
just like that.
Okay, great. And this happened about a month ago. This started.
I think so, around there.
Okay. So those are both abnormal disfluencies categorized under stuttering. And the third one is prolongation. So this is where a child or adult might stretch out a word without kind of meaning to for emphasis. So I'll stretch out the word the. So they might say the to go through their sentence there without meaning to make anything sound different. Again, something that they're not in control of. So stuttering is also accompanied by physical tension, secondary behaviors, negative thoughts and emotion about one's speech, as well as decreased communication skills, or basically decreased desire to interact, maybe because of their stutter. Do you have any questions about any of those?
What's a secondary behavior?
Sure. A secondary behavior, I'll mention physical tension too, because I think this is the best way to kind of talk about it. So secondary behaviors are things that a child might do voluntarily initially because of their stuttering, but then they kind of can't stop doing it when they speak. So it's something that they might not be aware of. For example, they might tap their hand to try and maybe regulate their speech in a way, or they might rub their legs, kind of like a nervous habit, or not look at a speaker, again, just because of nerves. Whereas physical tension, let me see here, I thought I saw. Yeah, so does Charlie blink his eyes a lot and have tension in the neck sometimes when he talks?
Yeah, I think that's what's going on, at least. It looks like tension, yeah.
Okay, so those are signs of physical tension, especially if it's only when he's speaking. So basically those things he is not in control of, that's kind of just something that's associated with stuttering. So stuttering can impact respiration, phonation, and articulation. It sounds like right now it's just affecting his articulation, though respiration can be a factor in those blocks. So yeah, that is basically what stuttering is. Any other questions?
Yeah, I mean, why him? Why does he have it?
Sure. So the cause of stuttering, there's been a lot of research going into this, and there are kind of a lot of factors. there is a genetic component that's come about in research. So basically something biological, possibly within a family. So they've done twin studies to show that maybe two twins, one of them was adopted by another family. If the twins do not have any biological component, nobody in their family that stutters, even though the twin that was adopted may be in a family with two parents that stutter, that doesn't make their stuttering, it doesn't make it any more likely that they will stutter, because it's not an environmental thing. There's nothing within Charlie's everyday life that's going to be causing his stutter. Though, different situations might bring out his stutter a little more because he's nervous. Nothing caused it to begin with. It's nobody's fault. Also, there could be cell mutations. So there's a cell called the lysosome that's basically the garbage cell. It takes away the things in the brain and breaks them down that we don't want there. There could be a disruption there that is causing him to not be able to break down things in speech as well, basically. And there's a neurophysiological component. So basically, we have the left side of our brain and the right side of our brain. Fluent speakers use the left side of their brain for communication, whereas people who stutter tend to use the right side. And they do not have as dense of white matter, which is what we use to communicate things in our brain. They're kind of the message senders. They have a decreased white matter integrity. So that's something else that's been looked at for a cause of stuttering. So it's still really hard to know, why a certain kid, but it's important to know that it's not your fault, and that there is a neurological impact at hand here. Nothing anybody can help.
Okay, so can it be fixed, or is he going to be like this forever?
So it's very hard to say. That's a great question. There's about 1% of the population that stutters, 3 million in the US. There are a couple factors with Charlie that kind of make him high risk, which makes me think that it's pretty unlikely for his stuttering to ever diminish 100%. Within therapy, we'll do everything we can to reduce his stutter. But some of those risk factors are his age. So I have here that he is 8 years old and that he started stuttering about 3 years ago. Okay, so usually if it's within 6 months, that's a good sign, but he is out of that 6-month range, which puts him into the high risk factor. His age also, 8 years of age is a little older for a kid. Usually within preschool age, that's considered as young for a low risk factor. The physical tensions that he displays, those are also a high risk factor, so his eye blinking and tension in the neck. I have here that he has become recently frustrated with his speech sometimes.
Yeah, he's definitely noticing that it's there.
Okay, gotcha. That's also unfortunately a high risk factor here, and the fact that you said that the blocks have started more recently, which means the stuttering is getting a little bit worse, it seems. Just another risk here. So those things all together, they just basically indicate that he may never kind of recover from his stuttering. So it's awesome that you're here to get him into therapy so that we can start that process. Do you have any questions on treatment?
So what would therapy entail? Like, what would be the end goal for him, I guess, at this point?
Sure, absolutely. So basically our overall goal, as I mentioned, is to just greatly reduce his stuttering and definitely to change his mindset. Since he does have those frustrating feelings going on about his speech, and when communicating, we want to reduce those as much as we can. Communication is great, and we don't want to see it hindering anybody. So given the fact that he's aware of his speech, his physical tension, and his frustrations, I would like to go with a direct therapy approach, which means that we would kind of directly attack that stuttering in a positive way. So we would talk about the stuttering with him in a child-appropriate way, maybe using terms like easy speech versus bumpy speech for when he stutters. So we want to be open with him about his stuttering. We want you and your family involved as much as possible. We want to be open with him and with you guys about what situations does he stutter more in, what situations does he stutter less in, different things like that. So the kind of approach that I'm going for here is called multimodal. So taking that counseling aspect, how does he feel about his speech, trying to get those positive feelings about speech there. Using some education, so telling him a little bit about what his brain is doing when he's stuttering in a way that would make sense to him. as well as using the stuttering techniques, such as that easy versus bumpy speech that I talked about, trying to make things nice and concrete for him. So we want him to feel comfortable speaking. We want to put little pressure on him for communication, so a relaxed tone. There's no rush to get his words out. There's no competition for talking time or anything like that. So just using loads of positivity and having anybody who's important to him involved. So that's kind of my plan for the get-go. I know you're going to get him scheduled. Any other questions for me today?
I don't think so, not right now.
All right, well, thank you so much, Elisa. It was nice to meet you.
Thank you.
Cut.